Oh, my name is Barnabas. I'm a registered nurse, and I have been practicing in the Boston area for the last 18 years. And what a privilege to be introducing to you and bringing across to you a program on Vantage Care, which is a home care program that is bringing healthcare services in the comfort of your home. What is home care? Home care is healthcare and supportive healthcare provided by a professional. The beneficiaries of Vantage Care are the elderly, the sick, the disabled, and those people with developmental challenges. Think about the elderly. They are often considered isolated, neglected, and abandoned in the community because they have no one to take care of them. Talk about the sick. We bridge the gap between hospitalization and the home. Often enough, people leave the hospital when they are so weak that they cannot manage their own personal lives. So we have services that will support that kind of service. The people with developmental challenges or people with disabilities, they are not safe enough in the community to stay alone. We provide supportive care so that we meet their meals, their hygiene, their care, all those things are met. Why home care today? I mean, because the population growth of the world is exploding. And think about Uganda. Today we are 47 million people, and of whom 2 million people are the elderly. And in the next 20 years, we will be 75 million people, of whom 10 to 12 million people will be the old. And so people no longer die young. The life expectancy has increased, and this is due to advanced care, modern medications. Think of the vaccinations, sensitization about different lifestyles. People eat well-balanced diets, they drink clean water, and environmental factors. I mean, people exercise, there's less of alcohol and smoking has been all reduced. And so these people I talked about, the 11 million people, the old and the aged, they have their own package of diseases. They are not necessarily sick. They have non-communicable diseases. These are chronic diseases, and they include diabetes, cancers, kidney diseases, respiratory issues, Alzheimer's, Parkinson's, oral care. I mean, they lose teeth when they grow old. These are the diseases, the conditions that people live with in the community, but once not addressed, or if the doctors have no idea how they are faring with these conditions, it becomes, they get sick, and by the time they reach the hospital, they are very sick that they get to be admitted. However, if they are in the community still, we are looking at the needs an old person would need. If you are 90 years old, you can't manage your own personal life. I mean, talk about grooming. If you're a gentleman or an old woman, these people need bathing. They need to be dressed. They need help with toileting. They need medication management support. They need to be fed, making their beds, helping them with normal exercises, range of motion. They need help to reach the doctor, transport them with support. Also comfort and rest. I mean, we have them sleep and rest appropriately. For example, is the room too hot? Is the blanket too thin that they feel cold when they're sleeping? Is the TV too loud? Some of the examples. We also do housekeeping, cleaning the environment where they sleep, where they go, where they eat from, and their bathroom and toilet, and so keeping them company, companionship. So Vantage Care brings in the value of taking care of these people with safety and dignity and privacy. Of course, the information remains confidential. We also bridge the gap. We communicate to the healthcare professionals so that they know what's happening. When you say, what benefit do I have when I have services like this in a home? I mean, Personalized care is number one. The cost is very low compared to having someone stay in a hospital. It's 87% of people who have home care services heal faster and they recover better. We give them a sense of independence and self-sufficiency at home. Dependability, depending on these services, so families can remain doing their normal jobs, remain in your own community, do your own activities without breaking the cycle, the family unit. Say, you can't take off time off work to go take care of your loved ones. And you know, when you're at home, it's so easy for families and friends to come and visit you when you're not feeling well, but well managed there. So it's all therapeutic care in the home, given in the environment of your home. Also, and if something happens, there's early identification of a symptom that would bring someone to the hospital. So we prevent and also consider safety, rehabilitative. We also, the other benefit is if a number of clients are not going to the hospital, it means we don't have people staying out in the hospital verandas waiting in line to be admitted. I mean, it's also a right of citizens to be taken care of at home. There's also these diseases patients acquire in the hospital. They call them nosocomial infections. Yeah, so it's a benefit that doctors get information about their patients and they act accordingly. The ratios of patients to doctors and nurses is overwhelming. One nurse takes care of 23,000 people in a country like Uganda. It brings frustration, anger, and nurse burnout. So Vantage Care is available with so far the leading provider of home care services in Uganda, and we are involved in training programs. We teach the level of kindness, empathy, compassion everyone deserves to be treated with. We have support, supervision in home institutions, and we follow the people that have been trained to manage these clients in the home. We are also trying to develop strategic partnerships within the community. We are sensitizing the community about these services, so you can reach out to us and provide you professionals that can manage your loved ones. And for the part of the government, we really would like to be part of your healthcare family so that we are in this together and build a nation of healthy population. Thank you, and have a good one.